President Trump's doctor released an update earlier today saying he's doing well, isn't showing any symptoms, and his oxygen saturation level, something that typically drops in COVID patients, is near perfect. Back with us tonight is Dr. Helen Boucher, Chief of the Division of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Thanks for being here again.
Thank you.
So it's been 4 days since he first exhibited those notable symptoms. Is this comparable to what you have seen in patients of a similar age, similar situations?
Well, Emily, no two patients are exactly the same. And one thing to remember with this disease is that it can get worse in about the second week, around days 7, 8, 9. So still very important to keep an close eye on the symptoms and on how he is doing, just like we do on every patient with COVID disease.
Absolutely. We know he's taking remdesivir, he's taking dexamethasone, that steroid. How long do those treatments usually last? And do we know anything about the importance of the timing when it comes to symptoms in a COVID patient?
Well, these medicines were studied, remdesivir for use for 5 days in most patients, and the steroids for use as long as the oxygen numbers are low. So this is a reasonable duration, and hopefully they will be adequate, but it's very, very important to keep an eye on him. Remember, this disease has only been with us for about 8 or 9 months now.
Right. There's so much we're still learning. When it comes to these treatments, are these relatively available for the average patient? Are they costly?
Well, it's a great question. So dexamethasone is very cheap, about $1 a day for us to obtain at the hospital, and remdesivir is about $520 a day to obtain. So they're, reasonably accessible. They are available across the country, and most patients should have access to them, thankfully.
Okay, so I want to ask you about this. This morning, the president sent a tweet comparing COVID-19 to the flu, saying you can just learn to live with it. How similar or different are COVID-19 and the flu?
Well, they're quite different. So influenza, first of all, 90% of us have not been exposed to COVID. So we are at risk. And COVID does not discriminate based on who we are or where we are. So that's very important. Secondly, mortality is very different. We know that with influenza, about 35,000 Americans die every year from influenza. With COVID-19, over 210,000 Americans have died in 8 months. So these are very different diseases.
Really significant. All right, Dr. Boucher, thank you for your insight, your time. As always, we really appreciate it.
Thank you.